Hi, my name's Eva Altobelli. I am a psychiatrist, and I am speaking to you today from Home LA, our holistic wellness center here in Santa Monica in Los Angeles. Today, I'm going to offer a conversation around addressing addictive patterns with psychedelic assisted therapy. Afterwards, there will be a virtual Q&A that we will set up and send out a link for later. I am going to start with sharing a quote from Jiddu Krishnamurti. It is no measure of health to be well adjusted to a profoundly sick society. And my intention here is to share information and I feel so strongly about it that some of my personal philosophy does bleed into these slides. I appreciate your tolerance. As Voltaire says, what is tolerance? It is a consequence of our humanity. During our time here together, I'd like us to contemplate the potential use of novel therapies in addressing substance abuse and harm reduction. A couple of things I'd like to cover today are having a common language around how we talk about this, touching on a few of the different medicines and the way they can be used, touch on redemptive healing, as well as the importance of integration. And my intention is not to imply that anything here is right or wrong, just to create a space for us to discuss different ways these molecules can be used and the potential for healing. I would also like to acknowledge that this information doesn't come from me. This information was learned by elders who've worked in the field for decades, as well as non-academic healers in countries far and wide, and I thank and honor all of them. Let's jump into starting with some commonly used definitions. The standard DSM-5 definition for addiction seems to lack the complexity of what addiction, in my perspective, really is. Most addictive patterns seem to fall into a self-medication pattern, and by this we mean use to make the world we live in more tolerable, numbing one's feelings, escaping uncomfortable feelings, using to make it easier to go out and socialize, or make it easier to isolate. Really, any way to get an internal need met with an external source. The standard DSM-5 definition of addiction seems to miss the gray area where most of us live. Even the term self-medicating is complex and comes in different shades. In addition to the standard DSM-5, looking at this from the angle, the lens of self-medicating, there's also the lens of lack of sacred, lack of sense of connection to something greater than us, a sense of being without meaning. This, I believe, is another category that tends to lead clients into a path of addiction. As one of our goals here is to address the addictive patterns with psychedelics, let's start by defining addiction. It's commonly defined as engaging in ongoing behavior despite negative consequences. So I'll read the standard definition. It is taking more of a substance or for longer than you meant to, spending time trying to get, use, or recover from an item, cravings or urges, trying to cut down and experiencing shame about using, negative consequences in any aspect of your life, work, relationships, legal, health. Tolerance speaks to needing to use increasing amounts to get the same benefit, and withdrawal speaks to physiologic symptoms of discomfort when you no longer have access. I am being intentionally vague about the word substance because addiction can be engaging in any compulsive behavior despite negative consequences, and some of those behaviors are social culturally sanctioned, like workaholism, shopping, dieting, exercise. There are two well-known drugs that can kill us in withdrawal. That's benzodiazepines and alcohol. And there are a number of drugs that can kill you in combination with others. We're all aware of the opiate crisis. And of everything out there, alcohol is still our number one killer. Substance use can be lethal, and the fact that it is preventable is one of the reasons I find it so heartbreaking. In my experience, addiction is often a response to perceived pain. And pain comes in many different forms: loss, childhood violence and neglect, frontline workers and veterans, chronic illness, existential sorrow for the world we live in. Grief becomes part of who we are. Grief is like an initiation. Once we've stepped into that path, we continue to walk it, and it deepens and shifts us and does make us able to see this in other people. There's a wonderful book by Francis Weller called The Wild Edge of Sorrow that talks about the well of our shared pain and grief rituals. I feel that acknowledging addiction from this lens of pain may allow us to look at it and treat it with greater compassion and humanity, as opposed to pathologizing. Addiction is not the core problem. It's an invitation to look deeper. The abstinence-only model can keep us bound to a model where relapse and shame become barriers to getting help. Psychedelics invite a broader scope of contemplation around the driving forces behind our behaviors and allow us to see ourselves with a greater sense of kindness and curiosity. Neglect and developmental trauma are present in many adolescents and adults struggling with addictions. This leads to development of survival skills that can become maladaptive. Trauma in and of itself limits the capacity for novel thought and creative outlets, which keeps us trapped in our stories. The use of psychedelics in a safe and caring environment can enhance our cognitive flexibility, creating an opportunity to contemplate one's belief system, to deconstruct and reassess. This re-envision allows for a deeper connection to self and wholeness. Non-ordinary states of consciousness paired with ongoing support can help shift the way we experience our sense of identity, culture, society. These constructs play a significant role in addiction from an individual as well as systemic perspective. Transition takes time. It's not a 30-day prescription, and it's difficult to sustain in isolation. Evolving from self-soothing with external forces to learning how to tolerate discomfort is a journey. And being on this journey in community increases the sustainability as well as the power of the experience when we're witness and get to witness and support others. We discussed addiction from the typical definition and then broadened the view. Let's do the same thing with recovery. I'll read this for a moment as well. In 1983, during a smoking cessation study with doctors Prochaska and De Clemente, they identified a trans-theoretical model of behavioral change that has become referred to as the stages of change. The pre-contemplation stage is what it sounds like, not even open to considering change. The contemplation stage is where we're open to think about it, maybe discuss it, journal about it. There is then the preparation stage, which is where we're researching different ways we might consider engaging in making a change. And then there's the action stage, which is everything from detox to meetings to ibogaine and yoga. The next phase is maintenance. This is really doing the work. It's the boots on the ground. It requires patience and self-reflection and commitment to maintain the changes. Relapse is another part of recovery. It is a really normal part, and if relapse occurs, you're not at ground zero because you've already done so much work. It is part of the process, but it does get a bad rap. Recovery in and of itself is an interesting word and seems open for interpretation. Abstinence, sobriety, clean. These words imply judgment, that they're good. And just because you're not using doesn't mean you're not in pain anymore. I'd like to talk about the angle at which we see life from. This is I read this in an article by Dr. Ralph Metzner, and he was describing the angle at which we experience life through is probably 45 degrees about. And then he talks about working with psychedelics and how it really opens the angle to about 180. And it could even get as big as 360 when people are deep in an experience. They feel like they can see in their mind's eye, even behind them, or get a sense of feeling outside of what their five senses are. Maybe there are 6, 7, or 8 senses we haven't even thought of. So he really talks about a much greater angle. And then he touches on a story by Richard Pryor, where Richard was talking about his relationship to his crack pipe and how his pipe was telling him, you don't need groceries, you don't need your wife, you don't need the house, you don't need anybody. It's just you and me, baby. And the angle at which he was living in that phase of his time was very, very narrow. And this contracted, narrowed perspective is also something that happens to us when we're struggling with any compulsive behavior patterns like OCD or depression, rumination, addiction. They all tend to close and narrow the capacity at which we see the world from, which is a very difficult place to heal in. And that's why the benefit of psychedelics allow for this expansion. I'd like to go through the list of a couple of molecules that might be used in psychedelic healing. DMT, that's N,N-dimethyltryptamine. This is an analog of tryptamine. Ibogaine, which is from the roots of a plant indigenous to Africa. Psilocybin, which is a prodrug found in fungi, also known as mushrooms or magic mushrooms. Ketamine, MDMA, which is 3,4-methylene dioxymethamphetamine, also known as Molly or ecstasy. Ayahuasca, a brew made by combining a vine and leaves into a cauldron. Canna, which is a shrub in South Africa. Sassafras, which is kind of nature's version of MDMA. It's heart opening and somewhat energizing, from a tree. Tobacco, cannabis. There's a pioneer named Sasha Shulgin who came up with thousands of these potentially healing molecules. And he wrote this great book called Fickle, Phenylalanines I've Known and Loved. And I would like to take this opportunity to talk about a little bit about what to use when. The underground psychedelic world talks about these molecules in a way to categorize them either as heart or spirit. When we're talking about heart, they're really talking about MDMA, sassafras, canna. We're talking about entheogens. These are heart opening medications. They are well suited for treating PTSD. If you think about this, they kind of imagine a softening of your defenses, an increase of compassion for self and others, for love, for self-worth. It allows us to relax into an experience. It downregulates blood flow to the amygdala. The MDMA is a heart opener that was used in the research studies that have progressed through stage 1, 2, and 3 and are now being sent to the DEA in efforts to reclassify MDMA as a medicine to treat PTSD within a particular protocol of therapeutic use. Quite often, the pain our clients experience in early childhood is in association with an attempted connection to get their needs met that went awry. Misattuned attachment figures, unavailable or hostile environments. When we sit with our clients during an MDMA session, we're sitting with them while they explore the context of their suffering. The medicine acts as a catalyst, and our relationship can offer a corrective relational experience if we offer unconditional positive regard. An opportunity for clients to make meaning in their suffering. As Viktor Frankl states, suffering is pain without meaning. This is just a kind of an interesting aside. You need to hear a nice comment about yourself 12 times more than you need to hear an unkind thought about yourself to believe it. Hallucinogenics can induce a susceptible state, so we can make the most of the susceptibility induced by the state by maintaining our positive regard, knowing that what we show up with and what we reflect to the clients will feel amplified. And this is also a specific area where we have to be very careful for the potential misuse and having very trained hands on board. That was for what we refer to as heart medicine. Spirit medicine is the traditional psychedelics: DMT, LSD, psilocybin, mescaline, ayahuasca, cannabis. These molecules allow for an exploration into deeper realms of healing, traditionally used in cultures outside of America. The potential for healing with these medicines is more complex at times and can be transpersonal, allowing clients to explore potential causes of their suffering that are outside of this timeline, outside of this lifetime, outside of this dimension. Under the influence of a psychedelic, one may experience a questioning of culture, reality, sense of identity, their internal narrative around their value system. What is happiness? What is success? What is abundance? What is addiction? What is recovery? What is judgment? These medications can also offer enhanced cognitive flexibility, allowing clients and us to explore possibilities outside of the sometimes rigid scope of what recovery means. Treatment always starts, in my perspective, with the relationship. With the psychedelic medicines, clients really can't relax into the exploration unless they feel incredibly safe. So building the connection, building the trust, and the safe, non-judgmental space is incredibly important. In the room, we are also the tools, which is one of the reasons it's really important for us as clinicians to continually do work on ourselves and be mindful of what we take in and what we take on. Clients struggling with addiction can sometimes have a darkness in their pain that can feel otherworldly, and sometimes it is. At times, the pain doesn't even belong to the person. It can be ancestral or energetically alive, and these energies have the potential to shift like parasites. That might sound kind of far out, and there's a whole nother conversation referring to something called entities that we could have at another time. In the recovery community, I have heard of clinicians working with people that the clinician then feels a sense of darkness and pain and heaviness energetically that they get saddled with for days or even weeks until they realize. And that may sound a little bit more shamanic in process, and it is, but these can also be healed by attending to our energetic health and seeing energy healers. There is more than the 12 steps. I love the 12 steps because they're great for some, but I can also feel a little bit black and white to people. There is a one-sizedness that I've heard complained about at times. Harm reduction model, I feel, acknowledges the gray area where we all live. I have seen some clients struggling with sobriety have these tremendous transformative healing experiences, and then they come back into the rooms and they're told, you're not sober anymore. And this could be really not only shaming, but it would make some clients not able to share their experience. And it then becomes very isolating. Medications in general have experience, there's judgment around medications in general, whether it's Suboxone, benzodiazepines, ketamine. So it's really important for us to be open to exploring the potential role psychedelics play in recovery and be open to the conversation, the good, the bad, the ugly. The tools we're talking about come for several clinical indications, and the subjective experience is driven by dosing and route of administration. There's three kind of standard models that people talk about: psycholytic, psychedelic, and molecular. The molecular model is just the molecule itself, how it affects you without any psychotherapeutic intervention. The psycholytic model is just enough of the molecule on board to naturally melt away our defenses, both conscious and unconscious defenses. We even see this physically in the room, how the way people hold their bodies, their physical character armor relaxes and dissolves a little bit, and they become more available to self-reflection without judgment. They're able to see things from a broader perspective, really close up, macro, within the context of the situation, and then the context of their lives, and then the context of the lives of everybody involved. So it can become quite expansive, and that can be quite helpful in shifting the perspective of how we see things. One also can experience a greater sense of space between how they experience the world around them and how they respond to it. The research studies that used MDMA to treat PTSD were oftentimes Annie and Michael Mithofer were the doctor and nurse team on board, and they used internal family systems a lot. They found it emerged naturally because clients would go into a space with MDMA and say, a part of me really feels A, B, or C. And so that really invited the parts work conversation to the table. Okay, that's psycholytic. Psychedelic offers a potential for a deeper mystical experience where clients can travel outside of their egos and have the potential to transcend current experiences of reality and dimensionality. With the psychedelic experiences, both space and time become more fluid, and we can access ancestral lines and access powers of healing outside of the realm of what we experience in our normal therapeutic engagement. A wonderful anthropologist named Victor Turner wrote a book, and I love a quote he shares: ritual, including rites of passage, emerge in response to structure and its limitations. I bring this up because as I was reading that book, I was feeling into how individual healing versus group healing presents itself in our therapeutic programming. Whilst individual therapy is incredibly powerful, in recovery, for some, the group work is really essential. Recovery is a transition, and it's difficult to evolve through in isolation. Addiction can be fueled by shame and guilt embedded within our culture and society. And recovery can be a felt experience in community when we get to witness and be witnessed. Transparency, honesty are really hallmarks in the recovery experience, and this is amplified when we are in community. A mentor of mine, Charlie Grobe, authored an article with Marlene Dobkin de Rios and John Baker called Hallucinogens and Redemption, where they looked at hallucinogens for redemptive healing in 4 different locations in the world. The one commonality they noticed was the suggestibility experienced by individuals during this hallucinogenic work, which we touched on a little earlier when we mentioned the susceptibility and suggestibility that people experience. And as we, as therapists in the room, offer consistent positive regard, non-judgmental space holding, it's easier for clients to take that in. So the first of the 4 locations they documented in the research paper is a redemptive ceremonial healing in Native American peyoteism. This article was about for the treatment of alcoholism. Peyoteism is described as a spiritual approach to facilitate a sense of identity, groundedness, connection, and belongingness. Ceremonies are often organized when members of the community are in need of healing, and the search for redemption is the personal motivation for change. It's believed that the peyote spirit offers guidance and direction. Peyote is referred to as a psycho-integrator, integrating mind, body, spirit, and emotions in a safe, socially sanctioned religious setting. Another redemptive ceremony is ayahuasca and the Uno de Vegetal pilot study in Brazil in 1990s, comparing ayahuasca use in subjects struggling with addiction to non-drug using matched group. Many of the subjects with alcohol use also described impulsive, angry moods and behaviors. 11 of the 15 subjects stated that the ritual use of ayahuasca had a profound impact on the course of their lives. Subjects reported their daily conduct and orientation to the world around them had undergone radical restructuring. Ibogaine is a medication, is a root in West Africa, used commonly by the Fang people for rites of passage. It, however, must be medically supervised because it does pose cardiac risks. And there's a big first experience, and then the metabolites lasts for months. It's been said that when clients oftentimes leave the country for a several day or week immersive, medically monitored ibogaine experience, they come back as if they already have 3 months of sobriety under their belt, which is a really important window, because during that window is when bipolar is most commonly misdiagnosed. In clients in early recovery, it really looks a lot like it's easy to do because symptomatically it does look a lot like bipolar. There's impulsivity, irritability, mania, depression. We're really kind of all over the place and emotionally reactive and labile. And this experience is painful, and this is the post-acute withdrawal, which occurs for the oftentimes in early opiate recovery. And somehow, I don't really know the mechanism of action, but ibogaine metabolites in the system really reduce that and make clients able to come back and actually engage in the work of exploring what prompted their addictive patterns of behavior. Ibogaine may be an underutilized tool. It was used in large quantities for religious and metaphysical hallucinogenic experiences. It does cause the sense of death and a subsequent rebirth, allowing for individuals to come back with a sense of a new beginning. Ibogaine can also be used to reduce urges to use opiates the same way Suboxone is, in microdose formats. Ibogaine was used, in ceremonially in large doses. The microdose non-ceremonial use was for hunters because it increased an individual's capacity to concentrate, look straight ahead, stay on task, and not be distracted. The fourth of the redemptive healing research components was LSD and psychotherapy for alcoholism in the United States. LSD was studied in the 50s and 60s in low-dose and high-dose models, similarly to the way we were using MDMA and psilocybin in the research. The low-dose psychedelic to loosen up and dissolve conscious and unconscious defenses, and the higher dose to support mystical experiences. Research indicated individuals having a mystical experience do have a higher potential for change. Hallucinogens can shift our perception of reality, allowing one to perceive the sacred, a sense of unity, a mystical state, a feeling of connection and wholeness with a purpose, which may lead to the extinction of self-destructive lifestyle patterns. Internationally, positive research came out of the studies benefiting LSD specifically for alcoholism. Even Bill Wilson, the founder of Alcohol Anonymous, found its psychedelic treatment to be really transformative and therapeutic. But politics of the time did not allow for this. And in 1965, LSD was reclassified as a Schedule 1 drug with no medicinal or research benefit. So let's shift to harm reduction. Harm reduction and psychedelic use for recreation and connection is also something that has come up in conversation. Carl Hart wrote a great book called Drug Use for Adults or Grown-Ups, I think, where he talks about using opiates socially and recreationally to relax, the same way some of us here in the room may be using alcohol or cannabis. There are people that use psychedelics the same way, to relax, to connect, for spiritual exploration. And so being open to having a conversation around what drugs fall into an absolutely no never category versus sure, there is a space for this in our society and in our culture. That, however, I do want to separate from the use of psychedelics as a medicine. Because if we're using MDMA or psilocybin or ketamine to treat trauma or addiction, there is a container created, and it's a very intentional use, which can allow us to explore the sacred, not just from a religious perspective, but from what is sacred to you. What is important to you? What are you trying to cultivate or escape from? We'd like to be really mindful about the decision of when and how to use these molecules. They are a sharp tool and definitely need to be handled with care. Integration. This is an ongoing process, a lifelong process. Integration, synthesis, assimilation, any word you want to use to describe the contemplative process of exploring ways to make meaning of what was discovered during the medicine session, and the actionable ways to bring a greater sense of health, wholeness, and wellness in a sustained fashion to your body, your spirit, your soul, lifestyle, your relationship, your marriage, parenting, your relationship to money, your relationship to the earth. This is where we get to make the big paradigm shift from healing ourselves as individuals to the awareness of healing within a community and within the system in our society. There's a quote, I can't totally remember. It's something like, if a plant was dying in a toxic environment, would you diagnose it with sick plant syndrome? As I was preparing for this talk, I was thinking about the distinction between addiction and addiction rooted in trauma, and to be specific about exactly what we're treating. I do see psychedelics as a clear tool for treating addiction with roots in trauma, as can be seen with the research utilizing MDMA for PTSD. The third phase clinical trial has been completed with good results, and I believe we're in the process of hoping to reclassify MDMA as a medicine to treat PTSD. But discussing behavioral components of addiction can be reductionist. There's always a why underneath. And contemplated use of psychedelics can allow us to explore the why from a number of different perspectives. Psychedelics can aid in exploring the role culture plays in addiction in regards to gender, race, socioeconomic opportunities and expectations, our history, our stories, folklore, mythology, and archetypes, continuing to explore the causal dynamics of how we got to where we are and what opportunities are in front of us. So, in conclusion, the use of psychedelics for healing trauma rooted in addiction is a transformational path, I think. There's also a role for psychedelic facilitated group discussions about how we make sociocultural changes. And I see this as an opportunity for all of us. And based on the mental health and addiction epidemic, I actually see this as our responsibility. It's been a pleasure spending some time with you, and I do look forward to seeing you in the chat room for questions and answers. Thank you.